Hi, it's Rosalie. I wanted to give you some useful tools for low back pain. Yeah, it happens so often, and there's some things that I find really useful for most cases, regardless of what the cause is. So these are things you could try, see if they're relieving, and let me know. The first is, let's see. So the first is just a hip flexor stretch. Yeah. So we spend a lot of time with our hips flexed. We're either, sitting at our desks, or in my case, I'm sitting at my desk and then I'm working in my garden, which, is the same position but with a different relationship with gravity. So just taking this tissue in here that spends a lot of time being short and putting it in a lengthened position, and just a couple key things. Don't put your rear heel down because that moves all the stretch into your calf. You want to, I'll use the other leg, you want to feel the stretch sensation right through here. So from the front of your belly to above your knee, and you're going to keep your pelvis oriented upright, like the same as when you're standing, and then just move yourself deeper down to the ground until you've got a nice intense feeling there. Shouldn't be painful, but it could be intense. And once you've got that intense stretch feeling, just wait. Don't try and go deeper into the stretch, just wait. Give it some time and let it change. It might take 60 seconds, it might take 2 minutes. And then once it's changed, once the intensity has gone away, you can do it again, get a little bit deeper, and then wait again. So that's it, hip flexor stretch. The next one is, because regardless of how much we're moving around all day, the muscles between our pelvis and our rib cage might not actually be moving very much, because you can walk and you can do all kinds of stuff, but the relationship between the rib cage and the pelvis might not be changing, which means there's not a lot of motion happening. So having a real specific intent to do motion there, I like to do two things, and you can do them both ways. One is more helpful for some types of back pain, and one is more helpful for the other. The first is to just kind of think about keeping my lower rib cage stationary and then moving my pelvis all around. I can go one way, the other way. I can sort of slide it one way or the other, or I could flex it one way or the other, so I'm shortening the tissue on this side. Go forward, go backwards, tilt forward, tilt backwards, make circles, make figure eights. So with my rib cage stationary, there's a lot of movement happening in the small muscles right along the spine. And then the same thing the other way. So think about kind of just keeping my pelvis stationary and then exploring the range of movement in my rib cage. Move my rib cage one side, the other side, forward, backward. I've heard from multiple people that this has been very relieving. It can be relieving not just for non-specific low back pain, but also for non-specific hip pain. Non-specific meaning like I feel pain in this area, or I feel pain in this area, or I feel pain in this area. That's all non-specific. Hopefully you could hear when I was talking to the wall. So yeah, it can even be useful for the more diffuse pain that you might feel in your thigh or on the back of your thigh in your hamstrings area. So, and it's kind of fun. I mean, really. Okay, let's see. That's two. The other one is just the old laying on the tennis ball or whatever kind of ball you have, and using it as massage tool. A word about that, we often think about massage as being something that is mechanically doing something, pressing on tissue, and through pressing on tissue we're like kneading bread and making it softer, sculpting clay or something like that. I think for this to work really well, it's helpful to think of it as a mirror for the nervous system. I'm going to apply pressure to an area of excess tension, and by doing that, tell my nervous system, inform my nervous system, show my nervous system, like, whoa, there's some excess tension going on here. And then the nervous system can say, whoa, thanks for pointing that out to me. I'll do something about it. So, it's an information tool, it's a mirror, but what do we do with it? We lay on it, right? So here's the bony nubbin on my back. You can probably palpate your own bony nubbins. There's two of them. And the pressure tool goes just kind of right between the bony nubbin and the spine and maybe slightly up. And then you can move it along one side of the spine all the way up to the base of the rib cage. And I would recommend starting with the lower position. It's a little more zingy, but explore the whole thing. And then you just, lay on probably the ground is better. I'm going to do this on the table so you can see, but the table's a little squishy. And take my slippers off so I don't get my blanket dirty. Okay. And then position the massage tool, and then just lay on it. Ah, that's nice. Now it's a little awkward trying to move it around, but you can just kind of inch your body around and find different spots. That works. So there it is in there. And once you find a really good spot, it might be hard to relax because it's, pretty zingy, but you just find it. You won't be making a video at the time, so you can take your time with it and just and then see, like, can I relax around that spot? What does my body want to have happen? If I can't relax around that spot, then can I make it less intense so that I can relax around that spot? So it's a process of inquiry and discovery. All right, I could be at that for a while, but moving on to the next thing. Let's see, we did that, and that. Oh yeah, this is one of the best. Save the best for last. And you might just have to take my word for it, because I don't think I'm going to go into the whole biomechanical, physiological reason for this, but I'll show you the thing. So, my slipper. So you just lay down, completely relax, sink into the table, and the exercise, it's not a strengthening exercise. It could have that effect, but that's not the intent. The exercise is to retrain your body, and so what you do is you pick a leg, this one, and you just slowly lift it off the table. I'm actually moving right now, but it's hard to see. You don't have to lift it very far, but I'm going to just lift it a bit so you can see that I'm doing something. So the idea is that as you slowly lift your leg, you can, it's good to do with your eyes closed, you can notice all of the muscles that come into play. There's muscles in my butt, there's muscles in my low back, there's muscles in my low back on my other side, there's muscles in my front of my knee on my side I'm not lifting up. So all of those muscles are contracting, and then as I set my leg down and really let it get supported by the table again, bit by bit, all of those contracting muscles relax. And then I do it again. Notice everything contracting. And then set it down onto the table. Notice everything relaxing. Super. So you can do that just with your leg, or you can do that with your leg and the opposite arm. And the phase where you're just laying on the table, being completely supported by the table, is important. So you can have an extra breath right there. And do it again. So you would do that like, 3 times, rest, another 3 times, rest, do the opposite side 3 times, rest. And that's it. Those are the 4 like universally helpful low back and some types of hip pain exercises. So hope they're helpful. I'll probably talk more about why I like them some other time. Thanks.